Let me ask you something straight. You have been eating less. You have been walking every morning. You have been trying. And yet that belly is still there, still tight, still stubborn, still refusing to go anywhere. And maybe you have been blaming yourself, thinking you do not have enough discipline, enough willpower. But I need you to stop and hear this. It is not your fault. It is because nobody told you the truth. In 2021, Harvard University published a study following more than 3,500 people over the age of 60. And what they found was genuinely alarming. People who had deep fat inside their belly, the kind you cannot pinch with your hand, had a 39% higher risk of early death compared to people of the same weight who did not have that kind of fat. Not 5%, not 10%, 39%. And here's what I really need you to understand. That fat is not just sitting there quietly. Right now, if you have it, it is working against you. It is releasing toxic substances into your bloodstream. It is attacking your heart, your liver, and even your brain. Every single hour, every single day. I am Dr. Saul Whitman, and in today's video, I am going to tell you straight why everything you have tried has not been able to touch that fat, and the only method that can actually get rid of it for people over 60. Stay with me. Part 1. Why visceral fat causes insulin resistance, not the other way around. Let's start with something I want you to completely change in your mind starting today. A lot of people think they have diabetes or insulin resistance, and because of that, they gained belly fat. But actually, the story goes the other way around. It is the deep fat layer inside your belly that is destroying your insulin in the first place. Let me explain this in the simplest way possible. You already know what insulin is, right? Think of it like a key. When you eat, blood sugar goes up, and insulin shows up like a key to unlock your cells, letting sugar in so your cells can use it as energy. That is how the body is supposed to work. But the deep fat inside your belly, what doctors call visceral fat, is not like fat anywhere else on your body. It does not just sit still. It constantly releases inflammatory substances into your blood 24 hours a day, 7 days a week. These substances travel straight to your cells and damage the lock on those cells. The insulin key is still there, but the lock no longer works. Sugar cannot get into the cells. Your body panics and produces even more insulin. And that is when the vicious cycle begins. What makes it even worse is that when your body pumps out that much insulin, insulin itself then signals the body to store more fat. And where does that fat get stored? Right in your belly, right around your organs. It keeps growing, releasing more inflammatory substances, damaging more cell locks, making the body produce more insulin, which stores more fat. Around and around it goes with no end in sight. And the thing that has saddened me most throughout my years of practice is watching so many of my patients over 60 blame themselves for this cycle, when in reality, their bodies were fighting against a biological mechanism that nobody ever bothered to explain to them. This is why so many people feel like they are fighting this belly with no results. Not because they lack willpower, not because they are lazy, but because that fat itself is actively working against their body from the inside. Part 2. Why exercise alone won't touch the dangerous fat around your organs. Now, I know what a lot of you are thinking. Dr. Whitman, I am still walking every day. I am still exercising. Why is my belly still not going down? And here is the answer that I do not think many people have been honest with you about. Exercise is great. It is great for your heart, great for your bones, great for your mood. I would never tell you to stop moving. But when it comes to visceral fat, that deep fat inside your belly, exercise alone actually has very limited results, especially for people over 60. The first reason is that when you exercise, your body burns calories. But the body is very smart. It prioritizes burning blood sugar first, then stored fat. And within stored fat, it prefers to burn surface fat, meaning the fat just under your skin that you can pinch before it ever touches the deep visceral fat. So after a 45-minute walk, you may have burned some calories, but the visceral fat is still sitting right there. The second reason has to do with age. Once you pass 60, your body produces less growth hormone, less testosterone for men, and less estrogen for women. These hormones play a key role in regulating visceral fat. When they decline, even if you work out consistently, your body still tends to hold on tightly to that dangerous fat. The third reason connects back to the insulin cycle I just described. If you are in a state of insulin resistance, meaning your cells are no longer receiving sugar properly, your body constantly feels like it is running low on energy. That makes you crave more food, especially sweets and refined carbs. And no matter how much you exercise, if you do not fix the root problem, which is the visceral fat causing insulin resistance, your body will keep on storing more fat. A study from the Mayo Clinic followed nearly 1,800 people between the ages of 60 and 75 and found that the group who only exercised reduced their visceral fat by just about 6% after 6 months of consistent training. Meanwhile, the group that also addressed nutrition and insulin control reduced theirs by more than 21% in the same time frame. Those numbers say everything. Part 3. The only method that actually burns visceral fat for seniors. All right, now we have reached the part I think you have been waiting for. And I want to be clear right from the start. This is not some miracle drug, not a vibrating massage belt, not an expensive supplement of any kind. This is a science-backed eating approach that has been well studied and proven, and it is especially effective for older adults. The method is called time-restricted eating. The basic idea is very simple. You only eat within a specific window of time each day, usually 8 hours, and you fast for the remaining 16 hours. During those 16 fasting hours, you can still drink plain water, tea, or black coffee with no sugar. Now, I know what you are thinking. 16 hours without food sounds awful, but hear me out. If you eat dinner at 6 in the evening and do not eat again until 10 the next morning, that is already 16 hours, and 8 of those hours you are asleep. All you really need to do is skip the late night snack and push breakfast back a little. It is not nearly as hard as it sounds. But why does this actually work against visceral fat? This is the most important part. When you fast long enough, somewhere around 12 to 14 hours in, your insulin levels drop to a genuinely low level. And when insulin is low, that is the only time your body actually begins burning visceral fat. Think of it like needing to drop the water pressure in a pipe low enough so the water can finally flow in the opposite direction. High insulin is the barrier that stops visceral fat from being burned. Fasting long enough is how you drop insulin low enough to break through that barrier. On top of that, while you are fasting, your body activates a self-cleaning process inside your cells. This process helps clear out old, inflamed fat cells, especially the ones wrapped around your organs. That is something exercise alone or simply cutting calories cannot do. Now, I do want to be straight with you about one thing. For people over 60, just fasting without paying attention to how you do it is not enough. There are a few things you need to keep in mind to make this method truly safe and effective for your body at this stage of life. The first thing is protein. Once you pass 60, your body loses muscle more easily. So during your eating window, make sure you are getting enough protein. For women over 60, aim for around 60 to 70 grams of protein per day. For men over 60, aim for around 80 to 90 grams. The best sources are eggs, salmon, chicken breast, lentils, and plain Greek yogurt. Protein not only protects your muscle, but also keeps you full longer during your fasting hours. The second thing is do not break your fast with the wrong food. A lot of people fast for 15 hours and then sit down to white bread or sugary cereal as their first meal. That will spike insulin immediately and wipe out most of the benefit of fasting. Your ideal first meal should start with eggs, vegetables, or a small amount of nuts and legumes. The third thing is staying hydrated and keeping your electrolytes up. During fasting, your body can lose sodium and potassium faster than usual. If you feel dizzy or get muscle cramps, that is usually a sign of low electrolytes, not a sign that fasting is hurting you. A small amount of sea salt dissolved in water or a little unsweetened coconut water during your fasting window usually takes care of that. And one last thing I especially want to mention for anyone currently taking diabetes medication or blood pressure medication, please talk to your doctor before trying this. Not because it is dangerous, but because as visceral fat begins to shrink and insulin improves, your medication dosage may need to be adjusted downward. That is actually very good news, but you need proper monitoring to do it safely. Part 4. Why is this method effective? I want to use this last section to explain further why time-restricted eating is especially well-suited for people over 60 and not just a trendy eating style that works the same for everyone. First, as we get older, our digestive system needs more rest. Eating continuously from morning to night or snacking late into the evening puts an enormous strain on the digestive system of an older adult. Time-restricted eating gives your digestion a real chance to rest and recover for a longer stretch each day. Many people who follow this approach report sleeping better, digesting more comfortably, and simply feeling lighter within just a few weeks. Second is the impact on chronic inflammation. This is something people over 60 should pay particular attention to. Chronic inflammation is at the root of most long-term health problems in older adults, from joint pain to heart disease to memory decline. A study from the Salk Institute in California followed overweight adults between the ages of 55 and 70 for 12 weeks on time-restricted eating, and the results showed that their inflammatory markers dropped significantly and their visceral fat decreased by an average of more than 4% in just 3 months, without changing what they ate at all. Third is how simple this is to actually do. For older adults, complicated diet programs that require counting every calorie or weighing every gram of food are very hard to stick with long-term and tend to cause a lot of stress. Time-restricted eating does not ask you to completely overhaul what you eat right from the start. You are only changing when you eat, and that is usually much easier to maintain as a lasting habit. Fourth, and this is what I find most fascinating from a scientific standpoint, is the effect on the brain. When the body is in an extended fasting state, it produces a special fuel made from fat called ketones. And the aging brain actually loves running on ketones. Multiple studies have shown that ketones help reduce inflammation in the brain, sharpen focus, and may help protect brain cells from age-related decline. So you are not just burning belly fat, you are also feeding your brain at the same time. One more point I want to bring up is combining this with light walking. I mentioned earlier that exercise alone is not enough to burn visceral fat. But when you pair time-restricted eating with a light 20 to 30-minute walk at the end of your fasting window, meaning right before your first meal, the results go up considerably. The reason is that at that point, your insulin is at its lowest level of the day, your body is already in fat-burning mode, and the walk pushes that process even further. Just 20 minutes of walking at that specific time can be roughly twice as effective as walking after a meal. And so you do not have to start this all at once. Here is how I usually suggest my patients over 60 ease into it. In week 1, just try fasting for 12 hours, finish dinner by 7 in the evening, and do not eat again until 7 the next morning. That is it. In week 2, push that first meal back by 1 hour, so now you are eating at 8 in the morning. In week 3, push it to 9, and gradually work your way toward feeling comfortable with a 16-hour fast and an 8-hour eating window. You do not need to do it all on day 1. All right, let me bring everything together from today. Visceral fat is not the result of a lazy lifestyle. It is a uniquely dangerous type of fat that actively works against your body from the inside by triggering insulin resistance and chronic inflammation. Exercise alone is not enough to deal with it, especially once you are past 60. But the good news is, you do not need anything complicated or expensive. Simply shifting when you eat, giving your insulin enough time to come down low, is when your body finally gets the signal to start burning that deep fat in a way that no workout or medication can replicate. The fact that you are at this stage of life and still care about your health says everything. It tells me you are not giving up, and your body is absolutely capable of changing when you give it the right tool. If this video was helpful to you, please share it with a family member or a friend who has been quietly struggling with that stubborn belly. They need to hear this. And if you find my content trustworthy and useful, please hit the like button so YouTube can recommend this video to more people, and subscribe so we can meet again at the next health tip.